Hi, I am Hugo Madeira, and in this short video I will be sharing one of the most important steps of our clinical practice. Let's talk about how to plan a smile. Motivate your patients. There are 3 patient-related key factors: satisfaction, understanding, and memory. A medical consultation is limited, with patients forgetting 40 to 80% of the information given. As you know, we absorb 50% of what we hear and see and 70% of what we say. That is why it's so important to talk with our patients and to take enough time for them to understand our treatment plan. Smile design is one of the key elements for diagnosis and treatment planning. So, let's see where to start. The midline, smile curve, and height are factors that guide the evaluation and design of a smile. Although we know the proportion of teeth, it's not always easy to capture the ideal photo. So, first of all, let's start by doing our photo protocol. It's very important to make our photographic protocol in the first appointment so we can register the initial situation and to make possible the digital smile design. Despite the importance of photos, the beauty of a smile and the dynamic integration of teeth, gingiva, lips and face are also a result from motion. Therefore, a video protocol should also be necessary. With all data collected, we start designing the smile that we and the patient pretend. So, let's do it. Digital photography and intraoral imaging devices have dramatically improved clinicians' ability to quickly and easily document patients' intraoral conditions, using a monitor to be able to clearly demonstrate to patients their oral health. A developed and evolved computer design software has become a powerful tool for showing patients the possibilities for improving their smiles. By understanding the aesthetic elements and learning how to incorporate technology applications into clinical dentistry, clinicians can predictively plan smile design and communicate results with patients. We usually say that a picture is worth 1,000 words, so for the patient possibility to visualize what we say, it's the best way to catch their attention. So when I allow my patients to analyze the image of their smile, I can directly understand what the patient likes or dislikes. This, for one hand, makes our job easier because we can understand better which are their goals. On the other hand, the patient can establish a more closest relation with us. Other great thing is the possibility that the patient sees the digital mock-up designed and personalized for them. They can predict the final result and see if it's what they desire before moving on and accept the treatment plan. So now we already have the pictures in the software, so we will start to mark the pupil lines and the smile lines.
Just to make a 2D smile design, just to motivate your patient to do the treatment and for him to see how it works in reality.
In this case, we use the curve of the lower lip, and we try to equilibrate the upper smile with that curve.
Yeah, and then it's important to match the teeth because this patient has diastemas.
Yeah, and we try to match the right proportion with our face.
And we have a library that is already done, and we can use the library to plan the smile and then personalize it.
Yeah, we can customize each teeth or not. If you want, you can, but
yes,
you choose. Of course, this is only to motivate the patient, as you said, and right, because then in the lab, when we want to have a 3D model, the 3D wax up will be more correct.
Yeah, this will be for planning the rehabilitation. This is just for communicate with the patient to make it simpler. Then we will show to the patient what we did and explain all the steps of the treatment.
Of course. And I think it's very important to show the patient the case, and also to show the intraoral scan, because the patient understands better the initial situation. And for example, he can see the occlusal view, a thing that he never saw before.
We have our smile planned and designed.
Yeah.
Let's
show to the patient.
Show it to the patient.
Yeah. Smile analysis and smile design generally involve a compromise between two factors that are often contradictory: the aesthetic desires of the patient and the dentist, and the patient anatomics and physiologic limitation. Aesthetic smile design is a multifactorial decision-making process that allows the clinician to treat patients with individualized, interdisciplinary approach. Patients do not have much ability to absorb all the information and advice regarding the treatment plan, as it would be expected from a dentist. As a result, it's important to know the ways to better understand and to better explain the treatment plan to our cases. Patients report that a lack of visualization of their treatment plan puts them into a discomfortable position, followed by fear and loss of independence. However, patients report that a lack of visualization of their treatment plan results put them in a discomfortable position, followed by fear. However, patients reported that being able to see their final result gives them a peace of mind. An image is worth 1,000 words, and the best way for patients to accept treatment plan is by seeing how their smile will be before starting the treatment. If you really want to motivate your patients and make the communication an easy pathway, now you know how to do it in a more effective way.